the what you say amount of blood which is coming out is very less or very minimal, or sometimes it doesn't come. So we can perform it in all these cases, in old patient, pregnant ladies, infants, in Varshabre and Nishagame also. So that is the advantage of Viddakarma over Rakta Moksha. And also it is told that you should don't use it in the place of Marma. Yes, this is absolutely to be highlighted point, that you should never use Viddakarma and Agnikarma on the Marmas. Only if you are that sure of that particular Marma, then only you should do. Or else Marma you should never touch. Okay. Next. Whereas the reference is seen in apart from other shastras. So in Chinese medicine, we can see similar references where in acupuncture and moxibustion. So acupuncture, the only difference in these two shastras is in acupuncture the needle is not hollow, whereas in Viddhakarma the needle should be hollow in order to take out the doshas, the locally present doshas, and the to give sorry to take out the locally present doshas out. And whereas in acupuncture the needle is not hollow, it is uh, a solid needle. And moxibustion, similar to our Agnikarma in our shastras, in Chinese medicine it is been told as moxibustion, where herbal powders or herbal vartis are used to give Agnikarma in particular places to relieve pain, in to get relief from particular diseases and all. So moxibustion is there, like kind of Agnikarma used in Chinese medicine. Coming to main topic now, vidhakarma. So for what it is explained? So mainly it has been explained for two reasons. One, Vedana Shanti, as well as in various rogas, it has been explained. Then instruments needed for vidhakarma is mainly these two needles, 26.5 needle number and 24 needle number, cotton spirit, to sterilize the area. Then why only these two needles? So in the shloka displayed over here, they have told one yava matra or ardha vrihi or one vrihi, we have to enter it while doing vidhakarma. So one yava, which is equal to one vrihi, is approximately around 11 to 13 mm, which is the exact size of 26.5 needle number. And why 24 needle number is because sometimes, as in some places where we have like the place has have more of mamsa pradesha, we have to do vedana karma deeper in the tissue. So there two vrihi pramana is needed. So hence exact to the double of 26.5 is 24 number needle, and hence that needle number is used. Then what is expected when viddakarma is performed? So in Shushruta Sharira it is told that Tatra ya Sukshma Shastra Vidha Avyaktam Asrak Sarvati. So it might be Avyakta or Alpa Vyakta Asrut when we do Viddakarma. So in certain places, what if like how, okay, I'll just tell one concept behind why this Viddakarma has been evolved. So there is a shloka in Shushruta Sarirasthana where I'll be dealing in further slide, where they have told many places where we have to do Rakta Mokshana. But to perform Rakta Mokshana in those places, we don't see any siras in that particular sthana. So what you like the thing is, there are minute siras which are present, which are not visible to our eyes. So what R.B. Gupte sir came with an idea is, he observed there is again based on srotas, the doshas will be present in that particular sthana, right? As for example, in Basti, if we take, so the amount of dravya which we give in Niruga Basti is different than the amount of dravya which we give in Uttara Basti. In Niruga Basti, we give 400, 500 ml per sitting. But is it possible to give that much amount of dravya in Uttara Basti? No, right? Because the srotas in Niroha Basti, where we give Niroha Basti, is more larger as compared to that of srotas where we give Uttara Basti. Yes. Similarly, when the sira is seen through a naked eye, the rakta mokshana when we do is in a more amount. Like that is 13.5 prasrata as told by Shushradasam. But wherever we don't see siras, what to do? But the patient is having that particular Vyadhi. We have to make sure that he gets relief from that particular Vyadhi. What should we do? So that time, this viddhakarma, just by pricking a needle, we will get the good results where the pain of the patient will be subsided. So, with such idea, Dr. R.B. Gopte sir came with this viddakarma procedure. Again, one more reference we get is Yathoktanam Adarshana. In Ashtanga Hridaya, they have told wherever we don't see siras, we should do Vedana karma, leaving the marma places. Wherever there is a marma, leaving those marma, we should do Vedana karma in and around the marma places. So this is one another reference of Vidha karma. Coming to Agnikarma. Again, Agnikarma is told for both Vedana Shanti as well as various types of rogas suffered. So types of Agnikarma. It might be Twakdagda, Mamsadagda. Twakdagda, which we do by using Swarna Shalaka or by just in colleges we do by just making the what you say making the shalaka red hot and just doing bindu karma in the most tender points. So that is only twak dagda. Whereas mamsa dagda, we go bit deeper. Sometimes in the cases where there are huge corns, kadara in the patient's foot or hands, we have to go more deeper and do mamsa dagda over there, so that the recurrence of that vyadhi doesn't occur. So these are two types of Agni Karma which is told. Again, based on Dravya, it is Shita, Snigdha and Ruksha. So again, wherever there is a Vyadhi which is caused due to Ruksha Guna, we use Snigdha Agni Karma to pacify that Vyadhi, and where the Vyadhi is due to Snigdha Guna, we use Ruksha Agni Karma to pacify that particular Vyadhi. So instruments needed for Agni Karma is one Suvarna Shalaka. Why Suvarna Shalaka is because Suvarna is Hridya and best out of all the dhatus which is seen, and mostly it is used in pain management like Kati Shula, Janu Shula, all those conditions. It gives more effective results, leaving behind no trace of scar on the skin. Then next is Mrittika Shalaka. Mrittika Shalaka is mostly used in planta fasciitis, calcaneum spur. All such cases we use Mrittika Shalaka. Then Loha Shalaka. Loha Shalaka is mainly used for kadara or cutting down the extra growth of mamsa in arbuda. All such cases, Loha Shalaka, various shapes of Loha Shalaka is being used. Then coming to Tamra Shalaka, where the size of the Shalaka is so much, where we use it as a cosmetic Agni Karma Shalaka, where it is used to remove the moles, wart, skin tag, etc. Why? Because Tamra Shalaka is Twacha, and it enhances the skin. What you say is the scar which is present after doing Agnikarma will be not there after, by doing Tamra Shalaka. Whereas if we use Loha Shalaka, there are chances of remaining of the scar. So hence, when we are doing cosmetic Agnikarma for cosmetic purpose, it is better to use Tamra Shalaka than Loha Shalaka. This various dravyas used for to make these shalakas are told because of the gamitva of Agni towards that particular tissue. Whereas, like for example, again, where there is an involvement of snayu, we use guda. For example, in frozen shoulder, where the tendons and ligaments of the muscles present in the shoulder are having swelling or inflammation. So there we use Guda. Why? Because when the Guda is heated, that particular heat is enough to reach that particular part of the like affected area and give the relief. So that particular temperature is enough. So then again, the doubt comes is in calcaneum spur and all and plantar fasciitis. Again, there is a tendon affected. Why not Guda Agni Karma there? Why? Because the skin over that particular area is very thick. So amount of Agni needed over there must be more. Hence, Mritika Shalaka is advised in such cases. So coming to the Agni Karma, there is no specific rules for Agni Karma as it is told in Vidha Karma has specific points based on specific diseases. But in Agni Karma, there is no such specific points. If they have told Atyugru Ruji Vayuhu. So wherever there is a Atyugra Ruji, wherever there is a most tender point, that time that particular place we have to do viddakarma. Then again for Uchrita Kathina Supta Mamsa. So wherever there is external growth, we have to cut it off by using Agni Karma again. So diseases indicated for Agni Karma are as follows: Granthi, Arsha, Arbuda, Bhagandhara, etc. All these diseases we can perform Agni Karma in all these diseases. So various common conditions seen in OPD basis. Why we can see while but just discuss that. So before going that, as I have previously told, there is one shloka where the vidhakarma is explained in Sushruta Sharira 8th chapter, a huge shloka which almost contains all the ashtangas of Ayurveda. So that shloka you have to be thorough with this, and most of the time, like almost 90 to 95%, this shloka will help you to treat patient through viddakarma. So the thing, the reference is Shushruta Sharira 8th chapter, uh, I guess 17th shloka. Yeah. So what it tells. So here, see, they have told. Just a second. So tatra padadaha padaharsha chippa visarpa vata shonita vata kantaka vicharchika padadari prabhutishu kshipra marmana uparidishtat dvayangule vrihi mukhena siram vyade. So here again I had told kshipra marma, the importance of kshipra marma in pain management. Just look into the range of vyadis told in this vedana karma: padadaha, padaharsha, chippa, visarpa, Vata Shonita, that is Vata Rakta, Vata Kantaka, Vicharchika, Padadari, all those things where there is a severe pain is just managed by doing Siraveda 2 angulis above Kshipramarma. So above Kshipramarma, that is, see, this is Kshipramarma. Whereas 2 angulis above, when we see in the 3D plane, 2 angulis above, just above the Kshipra Marma, where on the other side, where the Angushtha and Anguli, first Anguli meets, is called as is the Viddhakarma point for the Kshipra, based on the Kshipra Marma. So there, if we do with the karma, all these diseases which they have told, they will be there is this more reduction seen in such pain in such diseases. So similarly, it is told in Shlipada, Thanja, Pangu, then Apachi, in then Janu Sandir Upari Chaturanguli Gridrasyam, then Urumula Samshritam, in between the chest, in between the two stana, if we Urumula Samshritam Galagande, Etenetara Sakti, Bahucha Vyakyato. So Visheshata so again, one more thing I'll like to highlight is in Kasa Shwasa Yakrutodara Pligodara, there is there are points where you get immediate results. Immediate means immediate results, where it is told Visheshatastu Vama Bahu Purpara Sandir Abhyantarato Bahu Madhye Lihini कनिष्ठिका अनामिका मध्ये वा एवं दक्षिण बाहु यकृद्दाल्ये कफोदरे च एतामेव च कासश्च कासश्वासयोर अपि दिश्यन्ति. So for yakrutodara, lihodara and kasashwasa, the points are same. So it is told abhyantarata of purpa sandhi, so medial. So am I visible, my camera? Hello?
Yes, sir. Yes, sir.
Ah. So, yeah. If we see, if we take our hand, so what they have told is Visheshatastu Vama Bahu in Pliha. Pliha it is Vama Bahu and Yakrutodara it is Dakshina Bahu. So when we see Abhyantarata, so towards medial aspect, where in Bahu Madhya they have told, in between the Bahu. So this whole portion is Bahu. In between Bahu, near the Kurpara Sandhi, we have to do Vedanakarma. So where exactly? So on practice, the sir has seen, R.B. Gupte sir has seen that 4 angul is below, 4 angul is above. 4 angul is of that particular patient. I am not telling about the doctor. So there if we do with the karma, and one more thing is Kanishtika and Anamika. In between these two fingers, if we do with the karma, immediately the attack of that particular, like whatever the symptoms and signs are seen in that particular patient, immediately it will come down. So that I have experienced, that I practice, and it is such effective procedure. So similarly in Yakrut Udara, it should be done in Dakshina Bahu, and in both for Kasa and Shwasa. So there are various references told, Parivartika, Upadamsha, there we have to do in between the Medra. Then in Mutra Vriddhi and all, we have to do on the Vrishana Pradesha. So all these have been told. So this shloka, if you are thorough with, you can practice viddakarma and Agnikarma nicely. But before that, take training from a particular Vaidya who is practicing in his clinic or who is practicing with a good amount of patience. So again after that, those were almost of Kaya Chikitsa, and this they have told, they have streamlined in Urdhvajatru Vikaras also. See, in Jivha Roga, Adho Jivha, they have told to do viddakarma. Same is with Danta Roga. Then in Nasa Agrahane, so wherever there is a patient where he is not able to have smell, loss of smell, anosmia, they have told to do viddakarma in Nasa Agre. In Timira, Akshipaka, all those conditions they have told Lalata Apangayo Va. So in Lalata Pradesha and Apanga Pradesha, we have to do viddakarma. So all this, when we do, we get a good results. Apart from that, again in Jwara, Tritiyaka and Chaturtaka, ka Jwara, they have told do to vidha karma. So it is a mix of shloka where there is a pain management also, as well as there is a roga upashamana also. Then coming to one Kshipra Marma. So as we discussed, Pada Daha, Pada Harsha, Chippa, on all these things, we have to do two angulis. So if this is Kshipra Marma, two angulis above that is the point where we have to do viddhakarma. So this is the point where we have to do viddhakarma. For in all these vary Padadaha, Padaharsha, Chippa, Visarpa, Vata Shonita, Vata Kantaka, Vicharchika, Padadari, etc. Just a second. I'm sorry for the I'm sorry for the disturbance. So yeah, Shipra Marma has its own importance. Many of the cases are dealt with this one single vidha, uh, which is based on Shipra Marma. Taking Shipra Marma as a point of attention, we have to do viddhakarma, two angulis above it. And yes, how much vrihi or how much depth we have to go, it is most of the time it is ardha vrihi only. When okay, I will just show. If this is the needle, so half of this needle should be inserted in the skin. So that is called as in most of the conditions we have to use ardha vrihi pramana for the vedana karma. Then most common conditions seen in our OPD is Gridrasi or Vishwachi, where there is a radiating pain from lower back till the feet, where there is in some conditions patients are not able to walk, patients are not able to sit, patients are not able to sleep also. So there is a severe kind of pain. In such conditions, they have told Janu se upari adho chaturangula. So 4 angulas above, 4 angulas below Janu Sandhi. We have to do Vidha Karma in Gridras. And similarly, they have told in Vishwaj. But here there is a catch point where the position of the leg or the hand matters while doing Vidha Karma. If the position is not maintained, the results won't be seen. See here what they have told. Gridrasi Vishwachyoho Sankuchita Janu Purparasya. So when we have to do Vidha Karma, the knee should be flexed, and then only we have to do vidha karma 4 anguli above, 4 anguli below the janu sandhi. And even in hand also we have to just flex and extend. So I'll just show here. So my hand is flexed and just extension, semi extension I have done, and here exactly 4 angulas 4 angulas from the Kurpara Sandhi, 4 angulas here, that is 1 point here, and Adho, and 4 angulas above, that is here. So that this 4 angulas, like these points, will relieve Gridrasi and Vishwachi. Yes, again I would like to tell the position while doing with matters, and that will only fetch you results, or else the results won't come. This I have personally tried by extension, by extending the leg and extending the arm. The results are totally opposite. Understood? Sometimes the pain increases if you don't follow this particular position. It increases so that patient screams in pain. So much it increases. So position of the particular place or the particular limb is most important while doing this with. Next, avabahuka. Avabahuka, they have told bahu shosha avabahuka yorapyeke vadantya amsayor antare. So amsa sandhi is your shoulder joint. So shoulder joint, amsayor antare, in between the shoulder joint, we have to do viddhakarma. So where? Exactly where? Though now, the thing is, the anatomy, modern anatomy comes into figure. So here, when we palpate, there is a notch seen, there is a depression seen. So that exactly is a acromion notch, which is present on our shoulder. So in that particular notch, if we insert 2 Vrihi Pramana needle, that is 24 number needle, which comes in violet color base. So if we insert that completely, it enters it in that particular notch completely, not even with any obstruction in between. That time you can be sure that your vidha is perfect. So here again, we saw the importance of anatomy over here, because they have told amsayor antare. So we are clueless where exactly to do, behind, anteriorly or posteriorly, or in between the shoulder. So there, when Dr. R.B. Gopte sir had observed doing that, so most of the cases are relieved by doing viddakarma in the acromion notch. And again, more than viddakarma, here Agnikarma with Buddha works the most, because according to his experiences, my guru's guru experience, he has told that Viddhakarma helps only in 50% of the cases in Avabahoka. But when you do Agni Karma with Buddha, the result is seen more accurate. So Buddha Agni Karma is best in Avabahoka than doing Viddhakarma in Avabahoka, that is frozen shoulder or Bahu shoulder.